Immune drugs classification. A comprehensive overview of agents that suppress, stimulate, or modulate the immune system. Immune-active drugs fall into three broad groups: immunosuppressors, immunostimulators, and immunomodulators. Each group influences immune pathways differently, and understanding these distinctions helps clarify their clinical roles. Immunosuppressors, drugs that decrease immune activity. These medications reduce immune responses to prevent tissue damage, control autoimmune activity, or avoid organ transplant rejection. Core mechanisms: reduce T cell activation, decrease cytokine production, block immune cell proliferation,
Inhibit antibody formation.
reduce inflammatory gene expression. Clinical uses:
Organ transplantation.
autoimmune diseases, e.g., lupus, rheumatoid arthritis. Severe inflammatory disorders, prevention of graft versus host disease. Immunosuppressor drug classes and expanded examples: corticosteroids, prednisone, methylprednisolone, dexamethasone, hydrocortisone, calcineurin inhibitors, tacrolimus, cyclosporin, mTOR inhibitors, sirolimus, everolimus, antimetabolites, antiproliferatives, azathioprine, mycophenolate mofetil, mycophenolic acid, methotrexate, leflunomide. Biologic immunosuppressors:
Basiliximab.
belatacept, infliximab,
Adalimumab.
etanercept,
Rituximab. Tocilizumab.
abatacept,
Janus kinase, YAC, inhibitors. Tofacitinib.
baricitinib, upadacitinib. Other immunosuppressive agents: cyclophosphamide, chlorambucil, antithymocyte globulin, ATG, alemtuzumab. Immunostimulators, drugs that increase immune activity. These agents enhance immune responses, often used when the immune system is weakened or when stronger immune activation is needed to fight disease. Core mechanisms: activate T cells, NK cells, and macrophages. Increase cytokine signaling. Stimulate bone marrow production. Enhance antiviral and anti-tumor responses. Clinical uses: cancer therapy, chronic viral infections, neutropenia, immunodeficiency states, bladder cancer, BCG therapy. Immunostimulator drug classes and expanded examples: cytokines, interferon alpha, interferon beta, interferon gamma, interleukin-2, high dose, interleukin-12, experimental/limited use. Colony-stimulating factors, CSFs: filgrastim, G-CSF, pegfilgrastim, sargramostim, GM-CSF. Immune adjuvants: Bacillus calmette, Garin, BCG, imiquimod, TLR agonist. Therapeutic vaccines/oncolytic immunotherapies. HPV therapeutic vaccines, experimental. Talamogene laherparepvec, TVC. Checkpoint activators, rare, experimental. CD40 agonists, OX40 agonists. Selective immunomodulators, drugs that regulate or shift immune balance. These agents do not simply suppress or stimulate immunity. Instead, they rebalance immune pathways, often with complex or dual effects. These drugs are often referred to as biological response modifiers, BRMs, or selective immunomodulators. These agents rebalance the immune system by targeting specific cellular pathways, signaling molecules, cytokines, or the ratio between different types of immune cells. Core mechanisms: suppress inflammatory cytokines, enhance T cell or NK cell activity, inhibit tumor angiogenesis, shift Th1/Th2 immune balance, modify cell signaling and microenvironment. Clinical uses: multiple myeloma, myelodysplastic syndromes, multiple sclerosis, psoriasis and psoriatic arthritis, certain inflammatory and autoimmune conditions. Selective immunomodulator drug classes and expanded examples: immunomodulatory drugs, IMiDs, thalidomide, lenalidomide, pomalidomide. Biologic immunomodulators: some biologics can act as suppressors or modulators depending on the pathway. Ustekinumab, secukinumab, Aguzelkumab,
Dupilumab.
sphingosine 1-phosphate, S1P, modulators.
Fingolimod.
Siponimod, ozanimod, interferon-based modulators. Interferon beta in multiple sclerosis. Other mixed mechanism agents. Hydroxychloroquine, dimethyl fumarate, aglatiramer acetate. Natural and traditional immunomodulators. Many plant-derived substances are categorized as balancing agents, adaptogens, that help the body maintain homeostasis. Phytoimmunomodulators, compounds like curcumin from turmeric, can rebalance the Th17 and Treg ratio, decreasing inflammation while supporting regulatory cells that prevent autoimmunity. Rasayanas, traditional Ayurvedic herbs, for example ashwagandha, guduchi, are used to fortify the immune system against disease while contributing to general well-being.